In this video, I want to talk about properly placing the Gen 4 cuffs. So here's my Gen 4 cuff. You'll see that there's a light on the top. And you also have two buttons, a power button and an emergency stop button. So the emergency stop button, if the cuff is inflated and you want to deflate it immediately, you just hit that button and the whole thing will deflate. If you don't see the light on or flashing, then your tablet or your iPad or your phone is not going to pick it up in the app. So you need to hit the power button to turn that on. The lights can turn different colors. So the blue, this doesn't always flash blue. So you're going to connect the color to the app with the limb that the cuff is on. Okay. So when I'm putting the cuff on, I'm going to make sure I'm using the right size, first of all. And then when I put the cuff on, I want to make sure that the cuff can easily rotate around my limb but doesn't fall. I should be able to get 2 finger widths underneath the cuff easily, otherwise it's too tight. If it's too tight, it can compress the sensor that reads the limb occlusion, or basically the blood flow, and so you won't get an accurate or any type of LOP reading. The number one cause of that is the cuff you have on is you're making it too tight. I have the light facing up so I can easily access the buttons, and I make sure that the cuff is not too small where there's not gap within the flaps. So that's how to properly place it on the upper extremity. On the lower extremity, I would use, in my case, a large cuff. I put it on. You can see I can get just a little bit of overlap, so that's perfect. I'll put it through the D ring. And then I'm able to rotate the cuff, and I'll just keep it loose enough so that I can easily rotate it. I'll put this over to the side so that I have access to it. I never want to grab that housing unit because then you can damage the pump. So always just grab the cuff and try to be careful with the housing unit itself. So that's how to put on the cuff on the lower extremity and how to put the cuff on the upper extremity. Make sure that there's the ability to get 2 fingers underneath easily, move it around but it doesn't fall, and that there is overlap of the flaps.